So we have a panel with us. We have with us Amanda Donnelly, who is a staff attorney with OCR, formerly with the National Association of Counsel for Children, and new mother to Emmett, who is how many days old?
4 weeks.
Oh, he's 4 weeks old, so she came all the way up to present with her 4-week-old son, who's here as well. And then we have Allie Bettenberg and Glenda Melorano. I'm sorry, I never get that right. And Allie and Glenda are from the Bettenberg, Sharshall, and McGuire firm out in Arapahoe County. So that was one of the model offices that we contracted with in the 18th Judicial District. So my part of the presentation is to really just run through why in Colorado we decided to explore this model. And I'm going to flip through quite a few of these slides because a lot of this was part of the ABA presentation that talks about our statutory scheme in Colorado, and everyone here is very familiar with that, familiar with OCR. I will tell you it was really gratifying to present at the ABA conference. We had many, many questions about our model and our agency, and there are many people in other states that are considering establishing an agency like OCR for GAL services.
Okay. And I actually removed those slides.
Oh, you did? Oh, she's so wonderful. Okay. Okay, so many of you know, and I know there's a table of El Paso guardian ad litems back here, but when OCR was originally established in 2000, we actually inherited an office that had already existed down in El Paso County. And that El Paso office of the guardian ad litem was established within that community by some really forward-thinking child advocates and judicial officers. And what they did there was that they decided, rather than have independent contract guardian ad litems, they were going to pool their resources and establish a staff model office that would be attorneys working with social workers to provide best interest representation to children. We also have conflict guardian ad litems in El Paso County as well. So they would be independent GALs who handle cases when that office reaches its caseload cap or when there's a direct conflict with the office representing kids' best interest. Since 2000, OCR has had that office as part of our organization, and it really is a very successful model. And when we report information to the Joint Budget Committee, we would explain that model and the benefits of having social workers working alongside attorneys. And the JBC, the Joint Budget Committee, was very, very interested since about 2003 in exploring the development of those types of offices, that model. It's sort of, I think of it as a service delivery model in other areas of the state, most importantly in the urban Front Range areas, specifically in Denver. So since 2003, OCR was charged with exploring that as a model of representation. And for years, as a state agency, we struggled with how to try to establish that type of an office. Because if you think about it, there are tremendous startup costs with an office like that. And the startup costs really are around hard assets and overhead. Because if you have an office like that, you're paying for rent, you're paying for computers, you're paying for telephone, you're paying salaries, as opposed to paying independent contractors who are billing just for the time that they spend on their cases. So we really did truly struggle with it. And then in mid-2010, we happened to have a conversation with a woman in Connecticut, Carolyn Signorelli, who had just established similar offices in the state of Connecticut. And during those conversations, she explained to us that what she had done was an RFP, which is a request for proposal. And those of you who have been involved with OCR for any time, I think, are aware that in the summer of 2010, we did publish a request for proposals to develop staff model offices in Denver and in Arapahoe County. And we asked for people to essentially bid on what it would cost for them to handle cases in a multidisciplinary system. And we were really clear in the RFP itself about the criteria. So it involved having social workers work for the guardian ad litem and help the guardian ad litem in terms of those sort of social worker type issues, right? So things like appropriate placements, treatment modalities, services that would be available in the community. And this was something that was really cutting edge nationally. There was a lot of hype in child welfare across the country about these new child welfare law offices that were being established to have guardian ad litems work directly with social workers. Anybody have any question? If anybody has a question, just shout out, raise your hand, okay? Okay. Okay. Let's see, I think I went through that. Okay. So when we first were thinking about developing these offices, we had some very specific things that we were hoping to accomplish. And we hypothesized, frankly, that this type of a model would provide more effective and efficient delivery of GAL services. And again, the idea was that as attorney guardian ad litems, we are not necessarily the experts in those types of social concepts like treatment modalities, community-based services, all of those kinds of things. And oftentimes, I know as a GAL in the field, and for a lot of the independent contractors, you're in a position of sometimes having to rely on what the county department social worker tells you in terms of what's the recommendation or what's available. Okay. We also were hoping that with the establishment of an office like the office in El Paso County, that we would be able to establish institutional GAL presence in jurisdictions. So one of the cool things about that office in El Paso County is that they have a seat at the table when it comes to any kind of discussion about changes, whether that's changes in docketing, changes in the way cases are handled, the best practice court teams. And one of the things we frankly struggled with independent contractors is that if an independent contract GAL has a problem with the way cases are docketed in Weld County, as an example, it is sort of not an institutional issue that's taken very seriously. Sometimes it's considered to be, well, that's one particular GAL's problem. And what we had hoped was that we would establish that institutional presence and be more akin to like a public defender's office or a DA's office who is weighing in discussing with the court how cases are processed through the system. The other issue is that we really were hoping to increase the amount of out-of-court time that was spent on cases. A lot of what I think we do as guardian ad litems don't necessarily require a law degree. Those of us who've done it for some time, I think absolutely understand that and appreciate that. And there was a real discussion about whether or not some of those tasks, attending IEP meetings, attending various types of staffings, might not be more appropriately handled by somebody with an expertise in social services. And also, it would allow, if the GAL attorney had someone like that reporting to them, that would enable the attorney to attend a lot more of those types of ancillary meetings, right? Because the attorneys are often stuck in court. If you have a contested case, you may be stuck in court for several days and you're not able to attend some of the TDMs, the IEPs, family group conferences, that type of thing. Okay. And finally, part of our legislative mandate at OCR is for us to be assessing various models of delivery of best interest services to children. And this project absolutely dovetails with that. So, as part of the RFP, we identified certain very specific criteria that we asked people to make a proposal for us on. So some of those issues were that each child would be assigned a team. So the child would have both an attorney guardian ad litem and a case coordinator or social worker type professional. And that would be part of the child's team. That the model offices would provide additional staffing, training, and supervision. And the idea here was that there would be sort of the synergy that you get from a law firm model as opposed to be providing services as a single sole practitioner independent contractor. We incorporated all of the requirements of the Chief Justice Directive as part of the request for proposal. So it was clearly understood that in making these proposals, attorneys were required to meet with the child within 30 days of the placement, that they were going to be conducting an independent investigation. And then as part of this project, we added criteria to the CJD. So the CJD requires guardian ad litems to maintain ongoing contact with the client, the child, and the child's caregiver to the extent necessary to represent their best interest. As part of the RFP, we added a requirement that under this model that there would be quarterly face-to-face meetings with the child. So that's a additional and pretty substantive requirement for these offices. So they had to propose how they were going to meet that they would see each child every quarter. We also asked the offices to propose case caps because we did not want to get into a situation where we received bids that were really lowball bids that would have attorneys handling hundreds of cases. We didn't think that that was going to be an effective way to deliver best interest representation. We did not set case caps in the proposals, but rather left it up to the entities, to the law firms who were making these proposals, to tell us what they thought a reasonable cap would be. Anybody have any question about that? No? Okay. Okay. So ultimately, we received, I believe, 12 proposals from a large variety of people. Some of them were former independent contractors. Some of them were attorneys who were new to guardian ad litem practice. And basically, we convened a proposers conference. Those of you who were around at this time, I think, saw the request for proposal, which was, I don't know, Amanda, what, probably 70 pages long with all kinds of forms to sort of back into these numbers in terms of what would the staffing have to look like. And the request for proposal went out to handle a minimum number of cases, and I believe it was 125 cases. Is that right, Allie? That was the minimum, but proposers could propose to handle more cases than that if they could explain how they were going to do that in terms of staffing. And the idea would be that we would enter into essentially a flat fee contract with the model offices, that they would agree to meet all of the criteria in the proposal, and that we would pay them monthly in order to do that. The term of the contract, I think it started out as a 2.5-year contract, and we recently extended that for 6 months. So it is a 3-year contract. And our thought was, and this was a big mistake on my part, I have to take responsibility for this. We always assumed that we were going to do this model and then we would do a formalized assessment of this model, right? To make the determination of if in fact does this model really provide more efficient and effective best interest representation for kids. And really we didn't flush out what that analysis would look like. So we basically started to look at this about a year into the contracts, and then very quickly realized that it really was something that we should have thought of up front in terms of how do you really assess this? Because to really make the assessment, you need to have sort of the control, right? So you really need to be randomly assigning cases to either the staff model office or to independent contractors to see what's the difference. We entered into contracts with two organizations in Denver, Rocky Mountain Children's Law Center, that had an advantage, I think, of other proposers because they were an existing nonprofit that already did employ some social worker type professionals. And then also with a firm that was formed in Denver. It's Radley and Sutherland, and so they were former independent contractors who bid on one division of Denver Juvenile Court. And then our third entity is Allie's office, Bettenberg, Sharshall, McGuire, and that was originally 7 independent contractors who came together and formed a law firm, hired social work professionals, and started this multidisciplinary law firm. Okay. Another important aspect when we first started was that we needed a way to acquire data and information about what kind of time was being expended on cases. And so at about the same time we entered into this pilot project, we also went to what was then the KIDS system that we licensed actually from Kids Voice in Pittsburgh, Pennsylvania. And that's the case management system that we adopted in the summer of 2011 that ultimately has morphed into what we now call CARES. And for this model that employs both attorneys and social work professionals, that case management system is critically important because it really is the way that the child's team is able to share real-time information. So they enter their information. If I, as the case coordinator, for instance, attends a staffing, I enter my information real time, and the attorney assigned to that kid's team is able to look at that almost in real time to see, well, what happened and what are next steps and what are the other issues that we have to deal with. Anybody have any questions on that? No? Okay. Okay. I think I covered this. You all, I don't have to run through this. We really ran through this a lot more in depth when we were talking to the ABA about case management systems, but you know there are all kinds of categories in the CARES system, and frankly not a lot of consistency in how various individuals enter the same activity, and that's something that we're working on, and something that frankly I think impacted our analysis of this model, and we'll talk a little bit about that in a few minutes. Okay, and I think Allie is going to take over and talk a little. Those are the reasons that we started this pilot project and what we did to start it. And then Allie will speak a little bit about what it was like to be one of the pioneers, I guess, in this system of actually establishing a law firm and what the challenges were to that.
I'm not sure. Can you guys hear me if I'm sitting? Okay. Not great? Okay. No? Yes? Are you not listening? Is that why? Why don't you give me that? Because Glenda and I kind of teamed this, so if I stand up there, then she'll get missed. Linda's talked a little bit about how these offices. Is it closer? I always feel like we're going to do karaoke if we do this. It's on. Okay, is that better? Okay. In 2010, for some reason, there were several of us who decided we were going to spend our summer around my kitchen table. Generally, spend about 300 hours putting our proposal together, and it was beyond tedious. I think that when she referenced the 65 pages of forms and things, in turn, we had to create 65 or 70 or 80 pages of forms, back into numbers. Those kind of things were really difficult for us to do, and a lot of time was spent trying to figure out we were given some various numbers across the state about what was the average time per case. We all had what we spent on our cases because all of us were independent contractors, so we could tell by our own data. And to merge that together to figure out what really is realistic to do this in the future was a pretty tedious process. and then to incorporate the social work piece and what was going to be their role in that, and where were they going to fit in, and how were their hours going to incorporate into that overall time per case. And I think our initial number was very high, like kind of ridiculously high. I think it was like 60 hours a case. That's very difficult to do. We've learned that. Even if you have a lot of staff and a lot of people, and I can see Chris shaking his head, yes, 60 is really high. So I think one thing we all learned, and I'm sure that they would concur, is that what you thought this was going to be in 2010 is not exactly what it is now. So there are some basic tenets that are the same, and we've been able to work around some of those issues and sort of flush them out over time. I think one of the main things, and Linda hit on this a little bit, is that as independent contractors, you run your business very differently than the way a office is set up. So obviously Rocky Mountain didn't go through the growing pains that we did related to shifting from working for yourself, being responsible for yourself, to being responsible for yourself and now 20 other people, and employing them, and payroll and human resources, all kind of things that we none of us really had experience doing. So I think that's a big piece to figuring out whether or not this is the right type of situation that you want to find yourself in, because it is definitely different. Some of us had some law firm experience, some of us had been district attorneys, some of us were in kind of small shared office situations, and some worked from home. We had a very large combined amount of experience, so we were very blessed to have great amount of knowledge as far as being GALs, but to shift that into a structured office environment is not as simple as you might have thought sitting around my kitchen table. We also, I think Linda did talk about this some, is that we increased our responsibilities, and I think all three offices actually, the RFP set out a baseline, and we all have actually increased that above and beyond those in many different ways, and structured things in a way where we're trying to make sure we're increasing our contact with kids face-to-face, as well as just generally being able to be in contact with them more frequently. By having two people involved in your case, you enable yourself to do that in a variety of different ways, which I think is one of the benefits that we'll talk about later. The other piece is the office environment, and because a lot of us had or hadn't been in offices or firms or those kind of things, we had to establish an office. It had to be, in the area of where, in our jurisdiction, that was close, so that it was reasonable for people to get to us and find us. And that was also a shift for a lot of us, because I think when we have worked and we did what we need to do on our cases, and when we go home, we do what we need, and now you were tied to being in the office. If you weren't in court and visits, those kind of things, the expectation is that you're available within your office to staff cases, so that your CCs or attorneys, vice versa, can find each other to kind of go over things. That also requires a shift for somebody who maybe never wasn't coming from a firm environment. And in general, GALs, that typically is not coming from a structured office environment. So we had to work around how to do that and make those kind of shifts and those changes as well. I did talk a little bit about trying to back into this number, about what was our cost per case going to be, what was our hours per case going to be, was extremely hard to do when we identified what we thought would happen in a case. This is how many meetings in general, and I'm talking about a bell curve in which 80% of our cases we figured fit within kind of this same group or grouping of percentage or number of hours that it would take. And then you had your outliers over here that are ridiculously intensive, and then your cases that had less involvement, maybe they were post-termination cases, you're just seeing kids in adoptive homes. I call those the baby holding cases, where we go out and we just hold babies, and they don't have the same intensity level that the other large percentage had. But trying to accurately figure out what that really was not as simple as we thought. I think over time, we really have come to the conclusion that they all do really, that the majority fit within that 80%. And then we still have those outliers. But it certainly was not simplistic. Tracy and I spent a lot of time one night arguing with each other about why this number didn't work. And she called me at 2:30 in the morning and said, we didn't figure out how that progressed across the year, because your cases aren't all open the same day to the end of the year. And I think I actually slept that night. I was like, oh, I figured it out. And part of that was also something that was different for us, is to figure out how would we divide the duties. There are certain things that we obviously have to do. We can't send them to court. I've thought about it. Could you go? You'd be great, right? And then we also have certain requirements that we actually have to do with the CJD. But all of us are very attached to our cases. We came in with 240 cases, and all of us were not really interested in, well, they could do this. It was, well, I need to do that, and I'm going to need to do this, and I'm going to need to do this. And so we really had to, Maria's nodding over here. That's good. I'm glad that I'm summarizing it correctly. It was hard for us to figure out what control are we going to give up and trust in these other professionals to do these pieces to our cases. So we eventually kind of just had to agree that we're going to kind of 60-40 things, and really 60 meaning the case coordinators were supposed to be at about a 60% of the out-of-court time. I think our last numbers still show that all the model offices still are functioning about at 75% attorney, 25% the social workers, because it's very difficult to actually sort of be able to kind of learn to do that. And so I think it's starting to move over the last couple of years to where we're getting to where that's getting a little bit more what we all kind of came up with in the beginning. I don't know if I said this, but we came in with 240 cases of dependency neglect cases, and we came in with 160 delinquency cases. So our jurisdiction, our office is the only one that handles both delinquency and DNN cases. And we did that primarily because there were 4 of us who did a lot of delinquency work and really liked doing that, and felt like those crossover cases are pretty important. So we incorporated that, and now we carry about 400 dependency neglect cases and 325 delinquency cases, with 10 attorneys and 9 case coordinators. Some of us have an administrative component to that, and I think once we're fully staffed, we should be at 12 and 10, respectively, 12 attorneys and 10 case coordinators. One other thing that was fairly difficult was to figure out how would your caseload increase over the course of this time, at least this first contract period. I was lucky enough to get a lot of data from Arapahoe County that was willing to give me what did our old caseloads look like, what were these numbers, and their caseload numbers, as well as the state numbers, because for whatever reason, they aren't actually the same. For us to come up with what would that kind of extrapolation look like over time. And it turned out to be different, and we've had to reevaluate where our case numbers are going to be, and consequently our staffing plan, probably 2 or 3 different times, because it shifted, it changes. There's ebb and flows with how the cases are filed, and we weren't getting terribly consistent numbers. I think it's starting to get there now. At least this last year, it seems like I have a pretty good handle on how it increases. In our office, we actually set out in our proposal, which is why it was fairly lengthy and tedious, is that we really laid out a business plan about what in our whole management structure, there was pretty much just about everything that you could think of in there. So we didn't have to do that later. We've made adjustments to that as we've learned, okay, you can't really have all staff meetings every week. I can barely get them every month. And so there were some things that we've had to change, but primarily we wanted a really good working document that laid everything out for us. And a lot of those, the main things really continue even now. Our case assignments are still how we identified them then. Glenda and I do a case assignment process when they come in for us to have attorneys and CCs assigned as early as possible in our cases. We're pretty lucky, unlike our counterparts in Denver, to be able to get information pre-filing. So our cases are assigned before they come into court, and we've often been to TDM meetings before we actually have an initial hearing. And we've assigned our attorneys into teams for court weeks, and so that they can primarily have a docket on one week, and so they set very heavy on one week and less heavy on another. And those of you who've been in Arapahoe know that despite our case numbers, we still only have a DNN docket Monday, Wednesday, Friday, which almost everywhere else seems to have it every day. And for some reason, we still continue with this 3-day docket, which has meant that our attorneys primarily can get their stuff set in 1 week, but the reality is that most of them are there the other week as well. And, but at least allows me some flexibility to figure out who's going to be on call that week, because whoever team it is, that's who's on call, and that's who I look for to get to these meetings and those kind of things. That is a benefit, and I can talk a little bit more about that later, but that is something that we identified in our proposal as a way that we were going to do that. The other piece is that we didn't feel like just a number that we were going to have 75 cases or 85 cases or 65 cases was the right way to assess that. We developed a point system that weights our cases based on number of children, particular issues in cases, so that we can assess what that number is. So somebody might have 50 cases, but they might have a much higher point assessment number than somebody who had 60. And that tells me that right now they don't need to be taking any more cases. Our caseload caps were way higher than initially than they are now, because again, it was kind of this, well, we figured we could have more cases if we have social workers. And it actually is the reverse, because there's another piece to your job that you don't have to do with yourself, and that's talk to this other person and work with them. If it's you just say, I'm there, and no, and yes, we're gonna do that. If you're working with a team, you gotta go back and say, okay, do we wanna do this? So we really overestimated that initially. I think all of us knew that very quickly, like, there's no way you could have that many cases if you're really gonna truly collaborate with this other person on your case.
Allie, can you just tell people what your current case cap is in your office?
What did it go down to? I think it went down to 55.
Okay.
It started at 85, if I'm not mistaken.
And that's cases,
cases,
right? Not
right,
children,
right,
cases.
right.
Okay.
And so we've changed it twice. It keeps getting lower. It's now going to be 20. So I wanted to just touch a little bit about kind of some of our hiring process. Like I explained, that we have some very seasoned GALs that are our partners in our firm. The 8 that did start, yes, they were all very seasoned GALs, and we've whittled them down. No, there's 4 of us left that are seasoned GALs, and now we have 6 associates. So we just were discussing yesterday that we're outnumbered, and they're like sitting up there watching me, and I can see them. But that's a unique thing to this office that I think is really good, because I was a very young GAL working for another GAL when I started, and that's really the only way that you're able to do this. It's not very feasible, and it turned out for her to not be feasible to keep me as an employee, because just the way, I mean, this is not a high dollar type area of law. So for us to be able to hire, I'm supposed to say, where is she? Sarah, who is awesome, and just out of law school, and just took the bar 4 months ago, and that's a unique piece for us. Well, she did from Chris, and so Chris and I, have a fight going. But I think that's something to highlight, is that there are a lot of really young attorneys. I attended a presentation at CU Law School, and there was probably 40 law students sitting in there interested in this field of law that otherwise would not get the opportunity to be able to work in this. And truthfully, it's a little easier to teach new dogs tricks than it is old dogs tricks. And so, like, moving into this kind of a model for somebody who didn't know that any different is easier than it is for somebody who has done it their way for many, many years to try to, put yourself into this new model. So we look at various things. I mean, part of it is that being able to handle this work, and Renee and I have gotten pretty good about figuring out who can actually be able to deal with this kind of work. We've had a lot of attorneys who need jobs and apply for jobs and are really interested and do like their first dirty house case, and then that was it. And so we've learned about what do you really need to screen for, and what kind of things are really going to be the pieces that you have to have in order to be successful in it. Because I think all of you know, if you're sitting in here, it's not your run-of-the-mill area of the law. I wanted Glenda to talk a little bit about what our CCs do and some of their things that she looks for as far as when we're hiring them and those kind of things. So I'm going to hand this karaoke over.
Hello. Is it on?
Let's be close.
So within this model office, we also have case coordinators. We currently have 8 full-time case coordinators. One will be starting in another week. And then I carry 2/3 of a caseload because I also do supervision and staff development. But when we're looking to hire CCs into the law firm, we were looking for people that had a background in social work, people who had knowledge of the court system, and then others came to us simply with a passion and an interest for helping children and being involved with families. Allie calls quite a few of us recovering caseworkers, and the training curve for a recovering caseworker is quite a bit less than somebody who doesn't have that kind of a background. But within that concept, there are problems also, because you go from child protection to best interest. And we didn't realize how big of a leap that was, but at times that's a huge leap. We have a gentleman in our office as a CC who came to us from pretrial release. We have a case coordinator who came to us from the RCCF level of care. We have a therapist in our office as a CC. We look for people who have Spanish, fluency in reading, writing, and speaking Spanish so they can better help our attorneys in our meetings. We look for people who have a passion to work with children and who can collaborate in that effort to help children. We do a number of different internal trainings, and we also attend external trainings. But I think the biggest part and the most important thing that we do is we do our cornerstone training. And we look at services, placement, education, and visits, and everything that we do is around what services are being provided to that child by whom. The right service at the right time delivered by the right person is going to produce the best results. Is this the 5th placement for this kid? And why are these kids going through so many placements? Let's just stop. Let's take a look at this. Let's get all the information we can for the guardian ad litem. Doing kinship and friend investigations for possible placements in the short run or long term for permanency. What are the educational needs of this child? Have they been bounced in and out of 5 different schools and they're not even in middle school yet? What is the educational base that the child's coming from? Do they need an educational surrogate? Does somebody need to attend the IEP and sign off for that? And what is that going to mean to the overall progress and best interest of that child? And then lastly, our visits. We focus an awful lot on the visits. Are they happening almost immediately when that child is removed from the home? Even if they're being placed with a kin, who's doing those visits? What do they look like? How frequent are they? And we observe them so that we can tell the guardian ad litem, if they're not able to make those visits, what does this look like? What are the child's fears? How are those parents interacting with their child? And what are the deficits that might happen, as well as the strengths? So our training for CCs is around the law. We didn't know that you guys think in 6-minute increments. We didn't know how to do that. We didn't know why we would need to do that, but we know now. And we all think in 6-minute increments. And we're really proud of ourselves for being able to do that, because it was kind of a strange way of looking at things, but we get it. So there was a language base that we had to understand from an attorney being translated over to people who work with families and with children and in the social work. Conversely, it was a lot of fun when we were at DU, because we got to see attorneys who had no clue what we were talking about, because we were using this language of social work theory. And that was a lot of fun to see it happen in reverse. But we're coming together as a team. We're learning what each other's strengths are and how to really collaborate together in a model office to help the children and be able to show best interest.
I can just go. I think Glenda just hit on one thing, and this is just to say that the case management system for us is clearly listed under a challenge, because we use it as a completely full information sharing system, which I think didn't realize the amount of time that it takes to get your information in there. And what does that mean for what you do in a day as far as substantive work that's not data entry? So that's a challenge for us. We continue to brainstorm, all 3 offices work together, and as well as El Paso, to figure out how can we better do that, how do we be more efficient, what is really the information we need in there and not. And I mean, I think that's one thing that has been hard for us, but it certainly is something that we're working through. I think we've hit on most of the things that are the benefits. I mean, the inter-office training and support we have. The office structure in Arapahoe County certainly has given us the ability to do a lot of more institutional type things that Linda referenced. That also has allowed us to be much more uniform in how LAN is handled in all of our cases. And I've had the ability to work with different mental health centers to formulate how are we going to get through these release issues and what are we going to be doing to do that so that we are streamlining that process. Because when you look at your caseload and you realize that you have 326 of them that you have to file on, that gets a little overwhelming. I think Laura referenced overwhelming, and I was like, whoa, yes, it does. And so we definitely have been able to do that. And when there are changes that were needed, as far as our docketing and our best practice team, the GAL's office, at this point, I think it's fair to say, maintains the same sort of influence and level as the county attorney's office does. And that if we are going to argue about who's going to have what weeks and what color days and those kind of things, that our opinion and what we need is considered just the same as theirs is. I think that was most of it. And I know we've taken way too much time, so I'm going to give this to Amanda.
And I'm actually going to stand up again, just so I can.
Oh, you don't want to? Yeah. She didn't want to do karaoke for you.
I'll take this so I can watch the time. So you'll see, this was initially going to be presented by Professor Kim Bender, who was our partner at DU, and she's brilliant and eloquent, and she's very ill. So she couldn't be here today, so I'm going to try to, I've been living and breathing this for the last year and a half, so I should be able to talk about it without too much problem. I wanted to start with, we went into this project, we first started meeting with Professor Bender and the DU staff, I guess of last spring, the spring of 2012. And we went into it with some assumptions and some impressions. And one of the things is that the model is fiscally efficient. We have this system that our controller does quarterly reports, and we look at the amount of time that's entered. And the offices are spending more time on cases. So if the time that both the attorney and social worker combined, if all of that time was spent by an attorney alone, it would be costing the OCR and the state much more money than it is under the office. So that was one of our, I guess, pieces of knowledge going into it. There was a question, though, of how time is spent. So that was one of the things we were hoping to learn more about. And then we had anecdotally received positive feedback from judges and other stakeholders saying, there's always someone you can contact. We can get a hold of someone in the office. If we have a concern in Arapahoe County, we know we can call Allie. And there was an impression that the attorneys from the multidisciplinary law offices knew their clients better, that they had had more contact with them or knew more information about them. And we assumed that was from the social worker and the attorney working together and gathering that information. So we set out with DU to actually evaluate it and see if these things are true and what else we could look at. Going into this then, it was a second year MSW students who all had previous knowledge or experience in child welfare and juvenile justice, and this was their track that they were studying. We had 17 students who we divided into 5 groups to look at 5 different research questions. And they spent the full year. DU works on a trimester system, I believe, or a quarter system. So there was 4 parts to the course. And they spent the full year evaluating this. Their first step was developing a logic model, which we now know is something ideally we would have done at the very beginning of the process before the RFP was issued, to look at what it is we want to measure and how we could measure that. I'll talk about this more as we get into it, but there's things like cornerstone advocacy, and one of the things that we're promoting is visits. Well, visits aren't recorded in the care system, and so there's no way for us to really know, other than doing a case audit, which wasn't feasible, how often visits are occurring. That's something that's hard. We can look at how often the attorney is visiting the child, but not how often the child is having contact with their family members. Just to go back, so the fall was dedicated to teaching the students about the OCR and this model of representation and best interest representation, and they conducted literature reviews at that time. In the winter, they collected their data, and then in the spring, they analyzed their data and produced the reports. One of the big challenges going into assessing guardian ad litem work is figuring out how we can get information about youth and youth perceptions. And that was one of the benefits of partnering with DU, or something we thought would be a benefit, is that because we were part of the university course, we didn't have to go through the same IRB process, because it can be really difficult to get permission to have contact with youth. We'll get to this, but it ended up, ultimately, it was very difficult for us to get feedback from youth, although we had, ethically, we were able to do that. So when you look at a logic model, we're looking at what the inputs are, what the outputs would be. So in this case, the inputs would be what goes into the model office. So it's having case caps, trained staff, things like that. The outputs would be the services that they deliver. And then we're looking at short-term outcomes, intermediate outcomes, and then eventually long-term outcomes. And that's one of the other shortcomings at this point, is that the offices haven't been established long enough to actually even look at intermediate outcomes, let alone long-term outcomes. So the students, after conducting their literature review and working with us, we developed 5 research questions and organized them by inputs, outputs, and then outcomes. So the first question was, what are multidisciplinary law offices and how are they equipped? The second group looked at what do MDLOs do, and they really did the bulk of the data analysis and court observation, looking at CARES reports and things like that. And then the third group was looking at youth. Do youth have a voice, and are they engaged with the MDLO team? And we really wanted to look at youth perceptions there, and as the consumer, whether or not youth felt like they were getting a fair chance to participate and were knowledgeable about their case and who the players were. The well-being group, so are multidisciplinary law offices associated with greater youth well-being? And then safety and permanency, we're looking at safety and permanency specifically, and whether or not there was an enhanced safety and permanency. So for all 5 of the research questions, we used the same case sample. So we drew 600 cases, were randomly selected from all of the filings in Denver, Jefferson, Weld, Arapahoe, Adams, and El Paso counties for fiscal year 12. Is that right? Yes, FY12. So there was 100 cases from each county, and I can't remember how many. There were several thousand cases that were filed, and then we used a spreadsheet to randomly select them. And then the youth were drawn based on their ages. So we looked at youth who were 15 or over by July 1st, 2012. And those were the youth that we targeted to try to contact to get their feedback about their cases. And so this same pool of cases and youth were used across the sample. There was a combination of quantitative and qualitative data sources, and then looking at administrative data and then also original data. And I wish that Kim was here to talk to you more about the analysis. I can tell you they have this great sort of electronic system that they could plug everything into, and it could tell you whether or not, based on the chi-square and t-tests and things like that, whether or not things were statistically significant. The long and the short of it is we found very few things that were statistically significant, and I know we're almost out of time, so I'll kind of cruise through what we looked at and then sort of the limits on what we found. So the first research question was looking at what the MDLOs do and how they function. And there was 3 data sources for this. There was an online interview that went out to the staff of each of the offices, and then there were telephone interviews with individuals, and then an audit of documents that the offices had. And we were hoping to get from this a sense of what the employees, whether they know about the requirements that were the performance requirements that Linda mentioned earlier. Were they familiar with the Cornerstone Advocacy? Do they know what the case caps are? Do they know what types of things the attorney should be doing versus what types of things the social worker should be doing? Are they receiving ongoing supervision? And for the most part, the attorneys in the offices had the knowledge that we would hope that they would have as far as the training and access to supervision and feedback. There were some cases, like with the written documentation, there wasn't necessarily written documentation that was provided to us that demonstrated all of the things that we were looking for. But I think there's a lot of limits to that as far as there's some things that may be communicated in staff meetings that aren't necessarily in the employee handbook. So it was, again, hard to use that as an ultimate measure. Let's see, can I keep clicking here? So employee survey, and the next group looked at what the MDLOs do. And that was divided into 3 subparts. So how do outside professionals perceive the attorneys or perceive the offices? How do they spend their time? And how are they representing their clients in court or children in court? And for this, we looked at the stakeholder interviews from that year and compared comments and feedback from about attorneys who worked within the offices to independent contractors. And then we also conducted a judicial survey to get feedback on the attorneys about their perceptions in the 6 counties. We conducted focus groups in 3 of the counties with caseworkers and DHS employees to get their feedback. And then we analyzed a lot of CARES reports. And so it was running reports on each of taking the 600 cases that were the case sample and running reports on how time was spent. So what time in each category, and I think we sort of skipped this, but you all would know, there's 25 different types of meetings and like 17 different things that can be entered under contact. And so it was looking at those and trying to identify if there were any significant differences in time spent. We also conducted extensive court observation in all of the 6 counties. And that was it for this group. In those, you'll see our court observation form, whoops. A variation of this form is now being used for the attorney contracting process. And that was, I think, one of the overall benefits of this project is we learned a lot about assessing and what kinds of things we could be doing across the state for better assessment. But like, for example, the court observation form is based on the CJD requirements and gives us a way to actually document what's happening, and then it goes into a database where we can run reports and see if there's any differences between, are attorneys from multidisciplinary offices stating the child's position more often than independent contractors? And at this point, from our research at least, they are not. The third group looked at youth engagement and whether youth felt like they had a voice across dependency and neglect cases. And so in order to contact youth, we started with the list. I believe there was 112 youth over the age of 15 in this pool of 600 cases. And we sent out, first we contacted the guardians ad litem to see if it would be appropriate to contact a youth. There's for developmental reasons or trauma, or the youth was on the run. And we received contact information from the GALs. So the best way to contact this youth, and we asked that GALs notify the youth that they would be contacted. Unfortunately, of those, we sent out 86 surveys and received 6 responses. And we decided on this approach based on, we met with a group of youth from youth advisory boards in other counties that wouldn't be part of the study and talked to them about how best to get youth feedback, because we had planned on doing focus groups, and they said that that's really wouldn't be ideal, that it's awkward to talk about your case in front of other people who might know your GAL or they might know you, and they just didn't think that that was the best way. So we went with these online interview and survey questions, which didn't really work out for us. And then we also tried to conduct phone interviews, and so 59 youth were contacted. And oddly enough, that also resulted in 6 youth completing the phone interview. So we received responses from 12 youth total, which was pretty disappointing. And I think that might be, at least right now, I'm still kind of processing. We just got the results at the end of May, so we're still processing them and trying to decide what we do with this information. But I think right now that's one of the biggest takeaways is we need to develop a systematic and effective way of getting youth feedback so that we can have a better sense of how youth feel. The next group looked at, sorry, I can click through these. Oh, here's an example of the youth survey questions. So since we were having such a poor response, we then incorporated youth questions into this general survey. And these are the types of questions that we now use for our renewal process when we do the interview with a youth as a reference for GALs. So it's looking at the youth's understanding of their case and who's involved in the case and whether or not they feel like they're engaged. And I see that I'm out of time. So I'll just quickly kind of skip through. We had very similar struggles with the other. We had hoped to use trails data But that was very limited because social workers or caseworkers can record it either in their case file or on the electronic case system, so that was not a good source of information. So for the well-being and permanency and safety groups, we had hoped to get feedback from youth about their perceptions of their well-being and permanency and safety, but because the response rate was so low, we really didn't get any meaningful information from that. The feedback we did get was that youth, whether they were represented by an MDLO or an independent contractor, generally had positive experiences. Like everyone else, some of them liked their GAL or had a good experience, some of them hated everything and had a bad experience. Something that I thought was notable was there were questions around the team, and in our minds as sort of the research team, we thought of the team as being the GAL and the social worker from the MDLO, but youth who have independent contractors also saw a team in their department social worker and their GAL. So regardless of what type of model they were represented under, they felt like there was a team of people who were advocating for them. So I will just slide through this. And if anyone has questions about this report, we're going to continue to be working on it. But basically, our biggest lessons learned are that we need to look at measurable outcomes and measurable things, and that's very hard to define. Like when we are looking at well-being information, it's hard to really pinpoint what specifically a GAL can do that impacts the long-term well-being. So like one of our ideas is how can we start capturing well-being information in CARES, and we have to take a step back and say, well, what would be those items that could reasonably be associated to guardian ad litem representation? And so those are kind of the types of things that we're going to be focusing on this year, is trying to better focus what is measurable. And I think a piece of that will be scaling back CARES a little bit, or some of the ways that information can be entered so that we can focus more on things that are measurable. Because it doesn't, when there's 25 different types of meetings, we can't really associate specific meaning to those meetings because there's so many different categories. So at this point, whoops, I might not be able to go back. Our plan is to continue with the MDLOs and to continue to develop ways of assessing guardian ad litem representation across the board, and to really focus on meaningful ways to collect information from youth and youth feedback.
And I think we're out of time, but if anyone wants to, talk with us and get the specifics of the information we've gathered, we're more than happy to share that with you. But I think Amanda summed it up really well, that at this point, I don't think that we're looking at expanding MDLOs, because we certainly don't have the information to support that, but we really want to circle back and see if we can do a better job in terms of the assessment. And the one piece that I'm really most interested in is the perceptions of youth, because the way I look at it, at the end of the day, they're the customer. And we need to be doing a much better job of reaching out to them as we assess attorney services, whether it's in an MDLO or whether in an independent contractor model. So that's all we have. Stay tuned. I'm sure we'll have more to share with you. And again, if you have questions, let us know. We'll get you all the underlying information. Okay. Thank you.